Hi, my name is Dr. Hellen Nguchu. I'm a cardiologist and a medical service provider with Ponea Health. How I started going into cardiology is initially I'd always had an interest in the sciences. I actually wanted to be a nuclear physicist, but because the opportunities were not available in the country, I opted to do medicine because I had an interest in something scientific. After doing my undergraduate in medicine, I went in for internal medicine, which is adult medicine, which was a very interesting field for me. And having worked in the ICU, I came across a lot of patients with heart conditions. Those were the main patients we kept getting in the ICU. And that's what piqued my interest, and I decided to go and train further in cardiology. Following my training in cardiology, I came and worked with various consultants and seniors and gradually built up my experience. So what are the study qualifications you need to become a cardiologist? Well, one, at what I'd call Form 4 level, you probably need to be good at biology, chemistry, and mathematics. And then subsequently, once you do medicine, you do an undergraduate degree, which takes about 6 years. And then subsequent to that, you have to do internship, which is about 1 year. And then come back again, do internal medicine, which is a 4-year postgraduate program available at our local universities. And then you have to work for another 2 years. And after those 2 years, you go back again for training in cardiology. The training can take anything between a year to up to even 3 or 4 years. Fortunately, most of the training is actually locally available. You just need to be dedicated and focused, and you do need to do a lot of reading and research. So what are the services I provide? Well, cardiology is basically treatment of heart conditions and conditions of the blood vessels. The commonest conditions we have in this country is actually high blood pressure, but we also have diabetes. We also have what you call valvular heart diseases, which are diseases where the patient is born with a normal heart, but gets a disease that actually affects the valves of the heart and therefore causes them heart failure. We also have diseases that are basically caused by other conditions that the patient may have, and they start feeling fatigue, they feel breathless, they start getting leg swelling, they find sometimes they are confused. So these are the patients whom we end up seeing. In most cases, we actually end up as referrals. These are patients who are seen by other people and are told you need to come and see a cardiologist. Some of the services we provide would include, apart from consultation, we do basic procedures, something called an ECG, which assesses the electrical rhythm of the heart, an echocardiogram, which actually looks at mechanical function of the heart. It's an ultrasound of the heart and will give you a very clear picture of what is going on with that heart. Other tests that we will actually order will be based on what is required for that patient, but might require you to go for specialized x-rays that we call angiograms. And if there's anything wrong, we can actually offer you treatment at that particular point. The various conditions that we deal with, some of them are treated with medicine, some of them is just about lifestyle and diet, and others we actually have to do either minimally invasive surgery or we actually have to do open heart surgery. What I enjoy most about this job is you find a patient who comes in breathless, is not able to walk from their bed to the toilet, and once you start them off on treatment, they can actually climb the stairs to the 5th floor, 10th floor, they go back to work. And that is actually a very uplifting experience. Probably the most depressing is when you actually lose a patient, because we have what you call sudden death. So something happens to the heart, they get a heart attack, or the heart just beats abnormally and the patient collapses and dies. And in those cases, there's really very little that you can do. Some of the best things about this particular job is actually seeing your patients grow and develop and get comfortable and improve the quality of their lives. Thank you for joining us in this discussion. You can book my services on ponea.com, and I look forward to another discussion in the next episode.
Best healthcare option in 3 steps. Search, compare, book on ponea.com. Ponea, your healthcare companion.